Welcome back to our channel. Today we're diving deep into the topic of vitamin B12 deficiency, a condition that often goes unnoticed but should never be ignored. Vitamin B12 is an essential nutrient crucial for our nervous system, DNA synthesis, and blood cell production. Unfortunately, our bodies can't produce it on their own, so we must get it from our diets or supplements. As we age, our ability to absorb vitamin B12 slows down, leading to potential deficiencies. Today we'll explore the 10 symptoms of vitamin B12 deficiency that you should be aware of. Before we begin, remember that all the information in this video is fact-checked and reviewed by qualified health professionals. Number 1. Pins and needles in the hands and feet. Vitamin B12, a water-soluble B vitamin, plays a critical role in our nervous system. It is essential for the synthesis of myelin, a protective sheath that surrounds and insulates our nerves. Myelin helps to facilitate the transmission of electrical signals between nerve cells, enabling smooth communication throughout the body. When there is a deficiency of vitamin B12, this delicate process can be disrupted. Nerve conduction issues may arise, leading to a sensation commonly described as pins and needles in the extremities, such as the hands and feet. This tingling or prickling feeling occurs due to peripheral nerve damage, which can be more prevalent in older individuals as the body's ability to absorb and utilize B12 decreases with age. If left unaddressed, vitamin B12 deficiency can lead to more severe neurological complications, such as peripheral neuropathy. In addition to tingling sensations, individuals may experience numbness, weakness, or difficulty walking. Therefore, recognizing and addressing this symptom early on is crucial to prevent further nerve damage. To address vitamin B12 deficiency, it is essential to incorporate B12-rich foods into the diet, such as eggs, chicken, beef and dairy products, or consider B12 supplements under the guidance of a healthcare professional. Regular health checkups and monitoring B12 levels can also help identify and manage deficiency before it leads to more severe complications. Number 2. Fatigue. Feeling tired and fatigued is a common complaint, but when it persists despite getting adequate rest, it might be a sign of an underlying health issue, such as vitamin B12 deficiency. Vitamin B12 is vital for red blood cell production, which is responsible for carrying oxygen throughout the body. Without sufficient B12, red blood cells may not mature properly, leading to a condition called megaloblastic anemia. In this condition, red blood cells are larger than usual and unable to function optimally, resulting in decreased oxygen carrying capacity. As a consequence, the body's tissues and organs may not receive an adequate oxygen supply, causing feelings of weakness, fatigue, and lethargy. Additionally, vitamin B12 is involved in energy metabolism, and its deficiency can lead to reduced energy production within the cells. If you find yourself feeling excessively tired despite getting enough sleep, it is essential to get your B12 levels checked by a healthcare professional. They can determine if you have a deficiency and recommend appropriate measures to address it. This may include dietary changes to include B12-rich foods like fish, fortified cereals, and dairy products, or B12 supplementation as needed. By addressing vitamin B12 deficiency and ensuring optimal red blood cell production, you can improve your energy levels and overall well-being. Number 3. Depression. Depression is a complex and serious mental health condition that can be caused by a combination of genetic, environmental, and physiological factors. One often overlooked factor in the development of depression is the role of essential nutrients, including vitamin B12. During pregnancy, infancy, and childhood, vitamin B12 plays a crucial role in brain development and cognitive function. Adequate levels of B12 are essential for the proper growth and function of the brain's neurons, which are the cells responsible for transmitting information between nerve cells. Deficiencies in vitamin B12 during these critical stages of development may have long-lasting effects on brain function and increase the risk of developing depression later in life. Studies have shown that children who experience B12 deficiency during infancy may be more susceptible to mood disorders as they grow older. In addition to its role in brain development, vitamin B12 also plays a part in the synthesis of neurotransmitters, such as serotonin and dopamine, which are involved in regulating mood and emotions. A deficiency in B12 may lead to imbalances in these neurotransmitters, contributing to the onset or exacerbation of depressive symptoms. If you are pregnant or have young children, it is essential to ensure they receive adequate levels of vitamin B12 through a balanced diet or appropriate supplementation. Additionally, if you or someone you know is struggling with depression, addressing potential nutrient deficiencies, including vitamin B12, may be a part of a comprehensive treatment plan. Remember that depression is a complex condition with various contributing factors, and seeking guidance from a qualified healthcare professional or mental health specialist is crucial for accurate diagnosis and personalized treatment. Number 4. Yellowish skin. Have you noticed a yellow or greenish tint to your skin or the whites of your eyes? This discoloration, known as jaundice, can be an indicator of various underlying health issues, one of which is vitamin B12 deficiency. To understand how vitamin B12 deficiency can lead to jaundice, we must first delve into the process of red blood cell breakdown. When red blood cells reach the end of their lifespan, they are broken down in the body, producing a waste product called bilirubin. Under normal circumstances, the liver efficiently processes and eliminates bilirubin from the body. However, when there is a deficiency of vitamin B12, the number of fully matured and healthy red blood cells decreases, leading to increased red blood cell breakdown. Consequently, the excess bilirubin overwhelms the liver's capacity to process it, resulting in the characteristic yellowish hue of jaundice. In addition to yellowish skin, other symptoms of jaundice may include yellowing of the whites of the eyes, dark urine, and pale stools. If you notice these signs, it's crucial to seek medical attention promptly, as jaundice can indicate a range of underlying conditions, including vitamin B12 deficiency. Addressing vitamin B12 deficiency may involve incorporating B12-rich foods into your diet, such as organ meats, shellfish, fortified cereals, and dairy products. In severe cases, healthcare professionals may recommend B12 injections or oral supplements to restore optimal levels. Remember, jaundice can be a sign of various medical conditions, and only a qualified healthcare provider can accurately diagnose the underlying cause and provide appropriate treatment. Number 5. Blurred vision. The health of our eyes is crucial for our overall well-being and quality of life. Vitamin B12 plays a significant role in maintaining healthy vision, and a deficiency can manifest as blurred vision or other visual disturbances. The optic nerves, responsible for transmitting visual information from the eyes to the brain, rely on adequate B12 levels for proper function. When vitamin B12 is lacking, these nerves may not function optimally, leading to blurred vision or difficulty focusing. Individuals with a vitamin B12 deficiency may experience blurred vision, especially when looking at objects up close or far away. This can sometimes be mistaken for the need for prescription glasses, when in fact the root cause lies in the body's insufficient B12 levels. If you are experiencing blurry vision or other visual disturbances, it is essential to have your eyes checked by an eye care professional to rule out other possible causes. If no structural issues are found, it may be prudent to assess your vitamin B12 levels and consider supplementation if necessary. It's worth noting that a vitamin B12 deficiency can progress gradually, and visual symptoms may not be immediately apparent. Therefore, regular checkups and a balanced diet that includes B12-rich foods like fish, meat, and fortified cereals are essential for maintaining good vision and overall health. Number 6. No strength in the muscles. If you've been hitting the gym regularly and still feel that your muscles lack strength and endurance, it might be time to consider the role of vitamin B12 in muscle health. Our muscles require oxygen to function optimally, and oxygen is transported through the bloodstream by red blood cells. Vitamin B12 is crucial for the synthesis of red blood cells, and its deficiency can lead to a decrease in the number of fully matured and functional red blood cells. With fewer healthy red blood cells available to carry oxygen, the muscles may not receive an adequate oxygen supply, leading to feelings of weakness and fatigue. Despite exercising regularly, individuals with vitamin B12 deficiency may struggle to build strength and endurance in their muscles. Furthermore, vitamin B12 is involved in the maintenance and repair of muscle tissues, making it essential for muscle health. A deficiency can compromise these processes, leading to muscle weakness and even muscle wasting in severe cases. If you're experiencing muscle weakness and fatigue, consider getting your vitamin B12 levels checked by a healthcare professional. Addressing vitamin B12 deficiency through dietary changes or supplementation can help improve muscle function and overall physical performance. Incorporating B12-rich foods into your diet, such as lean meats, fish, eggs and dairy products, can help maintain healthy B12 levels. In cases of severe deficiency, healthcare professionals may recommend B12 injections or oral supplements to restore optimal levels more rapidly. Remember that muscle weakness can be caused by various factors, and it's essential to seek guidance from a healthcare professional for accurate diagnosis and personalized treatment. Number 7. Movement problems. Our ability to move freely and with ease is a fundamental aspect of our daily lives. However, vitamin B12 deficiency can lead to movement problems, affecting our mobility and coordination. As discussed earlier, vitamin B12 plays a crucial role in maintaining the health of our nerves, including the peripheral nerves responsible for transmitting signals between the brain and the rest of the body. When there is a deficiency of B12, these nerves can be damaged, leading to a condition known as peripheral neuropathy. Peripheral neuropathy can manifest as numbness, tingling, weakness or pain in the extremities, such as the hands and feet. As the condition progresses, it can significantly impact mobility and coordination, making it challenging to perform everyday activities like walking or grasping objects. Individuals with vitamin B12 deficiency may experience a loss of sensation in their feet and limbs, leading to difficulties in balance and an increased risk of falls. Reflexes may also be affected, further contributing to movement problems. If you're experiencing movement problems or any unusual sensations in your extremities, it's essential to seek medical evaluation promptly. A qualified healthcare professional can assess your symptoms, perform appropriate tests and determine if vitamin B12 deficiency is contributing to the issue. Addressing vitamin B12 deficiency may involve dietary changes to include B12-rich foods like meat, fish and fortified cereals or supplementation as recommended by your healthcare provider. Timely intervention can help prevent further nerve damage and improve mobility and coordination. Number 8. Headaches. We all experience headaches from time to time, but persistent or frequent headaches may be a sign of an underlying health issue, including vitamin B12 deficiency. The exact mechanisms linking B12 deficiency to headaches are not fully understood, but research suggests that it might be related to neurological changes caused by insufficient B12 levels. B12 is involved in the maintenance of the nervous system, including the brain. It plays a role in the synthesis of neurotransmitters and myelin, which are essential for proper brain function and communication between nerve cells. When B12 levels are low, these vital neurological processes can be disrupted, potentially leading to headaches and other neurological symptoms. Additionally, B12 deficiency can cause megaloblastic anemia, a condition characterized by abnormally large and immature red blood cells. Reduced oxygen carrying capacity in the blood may also contribute to headaches. Several studies have found a link between low B12 levels and headaches, particularly migraines. In one study, half of the women experiencing migraines had low B12 levels compared to those without a history of migraines. While more research is needed to establish a definitive causal relationship between B12 deficiency and headaches, The evidence suggests that addressing B12 levels might help alleviate headache symptoms for some individuals. If you frequently experience headaches, it is essential to discuss your symptoms with a healthcare professional. They can evaluate your overall health, perform appropriate tests, and determine if vitamin B12 deficiency may be a contributing factor. Supplementation with vitamin B12 or dietary changes to include B12-rich foods like meat, fish, and dairy products may be recommended to address the deficiency and potentially reduce headache frequency and severity. Number 9. Irregular heartbeat. Also known as tachycardia, an irregular heartbeat is a concerning symptom that can have various underlying causes, one of which is vitamin B12 deficiency. B12 deficiency can lead to a type of anemia known as megaloblastic anemia, characterized by abnormally large and immature red blood cells. Anemia can affect the heart's ability to pump blood efficiently, leading to palpitations, a fast heart rate, and feelings of fluttering or pounding in the chest. Additionally, low B12 levels can lead to reduced oxygen carrying capacity in the blood, which may put extra strain on the heart as it works harder to deliver oxygen to the body's tissues. If you experience irregular heartbeats, especially in conjunction with other symptoms like fatigue, shortness of breath, or dizziness, it is crucial to seek immediate medical attention. An irregular heartbeat can be a sign of a serious underlying condition that requires prompt evaluation and treatment. A healthcare professional can assess your symptoms, perform diagnostic tests, and determine if vitamin B12 deficiency is contributing to your irregular heartbeat. They may recommend B12 supplementation or dietary changes to help address the deficiency and support heart health. It's important to note that tachycardia can have various causes, and addressing B12 deficiency may not be the sole solution. A comprehensive evaluation by a qualified healthcare provider is necessary for accurate diagnosis and personalized treatment. Number 10. Memory loss. As we age, our ability to absorb vitamin B12 diminishes, and long-term deficiency can be linked to memory loss, disorientation, and even dementia in the elderly. B12 is essential for various neurological functions, including the synthesis of neurotransmitters and the maintenance of myelin, the protective sheath surrounding nerve cells. It also plays a role in DNA synthesis, crucial for the proper functioning of brain cells. When there is a deficiency of B12, these neurological processes can be compromised, potentially leading to memory problems, disorientation, and cognitive decline over time. While the link between vitamin B12 deficiency and memory loss is well established in older adults, it's important to note that B12 deficiency can affect individuals of all ages. In children and young adults, a deficiency can lead to developmental delays and learning difficulties. If you or a loved one experiences memory loss or cognitive changes, especially in older age, it is essential to seek medical evaluation. A healthcare professional can assess cognitive function, perform appropriate tests, and determine if vitamin B12 deficiency may be contributing to the issue. Addressing B12 deficiency through supplementation or dietary changes may help prevent further cognitive decline and support brain health. However, it's crucial to seek early intervention, as reversing memory loss or dementia is challenging once it has progressed. A balanced diet that includes B12-rich foods like meat, fish, eggs, and dairy products can help maintain healthy B12 levels throughout life. Additionally, regular health checkups and monitoring of B12 levels can aid in the early detection and management of deficiency. Remember, memory loss can have various causes, and seeking guidance from a healthcare professional for accurate diagnosis and personalized treatment is essential. There you have it, the 10 symptoms of vitamin B12 deficiency that you should never ignore. If you suspect you might be deficient, consult your healthcare provider to get your B12 levels checked and discuss appropriate supplementation or dietary changes. Remember, a balanced diet and a healthy lifestyle are crucial for overall wellness. Thanks for watching, and don't forget to hit the like button and subscribe for more informative videos like this. Stay healthy and take care.